Hi, I'm Bradley Swenson. I'm a Chief Revenue Officer in the software as a service industry. I spent over 2 decades scaling commercial revenue operations in healthcare, helping startups evolve into enterprise-ready companies by aligning innovation with business impact. I've been fortunate to have led high-growth teams across sales, marketing, and client success, negotiated transformational deals, and built strong C-suite partnerships that deliver both clinical and commercial outcomes. Today, I want to share a few key strategies for navigating complex healthcare deals with executive buyers, especially if you're in a startup looking to break into enterprise territory. So the first point, understand the C-suite's language and prioritizing. When you're dealing with C-suite buyers, especially in healthcare, you're not selling a product, you're solving a business problem. Every pitch should answer one of three questions. How does this improve clinical outcomes? How does it drive operational efficiency? Or how does it impact revenue or reimbursement? For instance, CFOs care about return on investment and scalability. CMOs care about quality of care and patient engagement. CIOs care about security and integration. Tailor your messaging accordingly. It's not a one-size-fits-all. The second point, build trust through proof, not promises. Enterprise healthcare deals are long, complicated, and ever-changing. Relationships are everything, but relationships alone won't get you across the finish line. You need validation. So use data, outcomes, case studies to prove value early. For a pilot site or point of value that shows measurable impact, that can unlock doors across the entire health system. It's important to create champions inside the organization who can speak to the results on your behalf. That's how you move from being a vendor to a strategic partner. And finally, point 3, align stakeholders and simplify the ask. In complex healthcare environments, there are always multiple stakeholders. The secret, make the buying process easy. Frame your solution around existing initiatives. Show how it supports, not disrupts, current workflows. Make implementation feel achievable, even in the middle of competing priorities. And always, always, always define next steps clearly. Remember, the more complexity you remove, the faster the deal moves. So conclusion, to scale your startup into an enterprise market, you need more than a great product. You need to understand the buyer, prove your value, and reduce friction in every interaction. Healthcare leaders are hungry for innovation, but only when it comes with clarity, outcomes, and trust. Thanks for listening. If you're navigating this journey, feel free to reach out to me. We can connect on LinkedIn, Bradley Swenson, or via email, brad@swenson.us. Let's build the future of healthcare together.